Hey there, it's Dr. Sarah here. Today, I have the pleasure of talking to Dr. Meivys Garcia, an infertility specialist and co owner of Markham Fertility Center in Toronto, Ontario. Today, we talk about options for single women thinking about fertility preservation, and we briefly cover egg freezing, IUI with donor sperm, and IVF with donor sperm. In the podcast, we use the word women, and in so, we're referring to individuals who identify as cis female. We appreciate that gender identity and gender literacy is complex and that each person determines themselves their own identity. We'll get into the podcast right after this quick message.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Welcome. Today, I'm super excited to have Dr. Meivys Garcia on our podcast. So, we are going to be talking about fertility options for single women, and that will include a little discussion around egg freezing. So, would you prefer Meivys or Dr. Garcia? Dr. Meivys.
Mavis is fine. Dr. Garcia, Mavis. It's all so great. All great here.
You're old friends here, right? Okay. So, Dr. Garcia, I would just like to start by asking you to introduce yourself and tell us a little about the work you do and how you got into it.
Absolutely. I'm an obstetrician gynecologist and fertility specialist. So that means I finished my medical degree at University of Western Ontario, in 2004. And then I did a 5-year obstetrics and gynecology training that brought me to 2009, where I got my Royal College certification in obstetrics and gynecology. And then from 2009 to 2011, I did a fellowship in reproductive endocrinology and infertility. And I have been working at Markham Fertility Center in Ontario, Canada since that time. And just recently, I became the medical director and co-owner of the clinic, something that I'm very excited about. My two other co-owners, Dr. Crystal Shan and Dr. Marta Weiss, are two incredible physician leaders that I'm very excited to continue to build the clinic with them. So that's what I'm up to right now. And how did I get into this field? I don't know. I've always been very interested in reproduction, to the point I know when I was growing, my grandfather used to have dogs that would breed naturally. He didn't have a business or anything, but he would just let them breed. And I was just fascinated by the process of babies and how that all works out. And as I went through my training in medical school, I was very interested in women's health.
Mhm.
And then as I went through my training of surgery and gynecology, I think I was just in love with helping women achieve their dreams. And initially it was all about the obstetrical part of it and helping them through pregnancy. And then I became really interested in helping them achieve that pregnancy. And ever since I started this field, I am head over heels in love with it. It just gets so interesting every single day. There is so much that is happening. It is so emotional. It is so personal. It's incredible. And it's a great honor to be part of this field and to help women with their fertility.
Oh, yeah. I couldn't agree more. Every time I deliver a baby, I'm just like, this is amazing. Um,
Yeah. And for me personally, I went through fertility myself. And everybody asked me if that's why I got into the field. And it isn't. I was already a fertility specialist. So I started my training in fertility before I was married.
mhm.
And then I was married. And of course, I knew I had to hurry and not waste. I was only 33 years old when I was married to my husband, who's still my husband. And I started trying and I couldn't conceive and I went through all the things. So I ended up going through 5 IVF cycles and 8 embryo transfers and lots of miscarriages. So definitely it has strengthened my relationship with this field and my drive to help women because I understand that on a very deep personal level what it's like being in that field. But no, I was already a fertility specialist when I was going through that. So I can't say that's the experience that led me to be here.
Yeah. No, I understand that. I've loved women's health since very early on as well.
Mm,
So we have a shared passion.
absolutely, we do, which is why we're here talking about it.
Exactly. And so that sort of leads into this discussion because both you and I probably experienced similar things when going through medical training. I hadn't yet met my husband. And when I actually started in OBGYN and did 2.5 years, but that's what we all talked about egg freezing and what were we going to do because we were all in our early 30s. And we knew that we unfortunately had somewhat of a time crunch. So let's talk about an example. Say I have a young early 30s patient that comes into me and wants to talk about becoming a single mom. What are the sort of the first steps that you would recommend for people to take?
Absolutely. So I want to back up that question a little bit just to make it a little bit more broad so that I can cover different aspects of that. So let's say a young woman, let's say she's 32 years old and she comes to you saying, I don't have a partner right now. I'm concentrated on my career. I want to make sure I meet the right person and I'm worried about my fertility.
Yeah.
So she might not be wanting to be a single mom this moment at 32 years of age, but she knows that she would do that if she doesn't meet somebody. So down the line. So for a person like that, it's essentially three options for a woman who is single and thinking, okay, what are my options in terms of safeguarding my fertility because there's no partner present at the moment. So the three options are freezing your eggs, using donor sperm to do IUI, in which case you do become like the goal is to get pregnant immediately, which is not something that sometimes young women want to do, or doing IVF with donor sperm, where you create embryos with the donor sperm, and then you can transfer those embryos for a pregnancy in the future.
Okay.
So freezing your eggs is, in a way, the best option from the point of view that it allows you to then meet somebody in the future. So you basically get your eggs frozen, and down the line, you meet the person that you want to start a family with. Ideally, you start trying and you do get pregnant on your own without any intervention, and those eggs were never used. That's actually best case scenario. But if you start trying and now you're 38, 39, 40, when fertility becomes a lot more difficult to achieve, then you can come in, thaw out your eggs, fertilize them with sperm, create embryos, transfer that embryo into the uterus, and have the same pregnancy rate of a 33-year-old woman. So the pregnancy rate goes by the age of the eggs at the times that they were retrieved. I'm going to go back and talk about that a little bit more, but that would be option number one. The benefit is that it allows you to pick your sperm down the line. Then there is option number two, which is IUI. So IUI would be the least expensive and least invasive option. That is a lot of the options that women in the same sex relationship use when they already have a partner. It's a sperm issue. So you buy the donor sperm from a bank. We take the sperm, we insert it inside the uterus at the time that you're ovulating. And the goal is to achieve a pregnancy on that cycle. And then you go on to become a single mother by choice. And that is a very valid option as well. And then there is the kind of in between those two options. So between freezing your eggs and meeting somebody in the future and being pregnant at the right moment, there is in between. And in between, we'll be doing IVF with donor sperm. So the eggs get retrieved. You do pick the donor sperm from the bank. You fertilize those eggs and create embryos. And then those embryos are frozen. And then you can choose to put those embryos back at any point in the future. It could be 5 years, it could be 10 years, it could be 20 years. If you do meet somebody down the line and you want to have a pregnancy with that person, then obviously these embryos are now donor sperm embryos. So you need to have that consideration. So there are benefits, there are pros and cons to each of these options. The IUI option is very minimally invasive, it's very inexpensive. Again, you just have to be willing to be a single mother by choice, which is a very valid option for many women. But I find in my experience, most young women looking at preserving their fertility are not really looking at that. They're looking at really having options down the line when they meet somebody. The option of doing IVF with donor sperm, again, it's a great option in that embryos are closer to baby than eggs are. So if I can tell a woman that you have 4 embryos that are frozen and genetically tested to be normal, I can confidently say that she's got a really good chance of having a baby from that, because the next step is just transfer and implantation into the uterus. For women that have frozen eggs, those eggs have to be thawed, fertilized with sperm. Not every egg not every egg that gets thawed is going to fertilize, and not every egg that fertilizes is going to develop into an embryo. And not every embryo is going to be genetically competent to lead to a pregnancy. So having frozen eggs, while it gives you the freedom of choosing a sperm down the line, you certainly don't know how those eggs are going to perform when they're thawed out and fertilized with sperm. Now, the younger that you are, the better. When you freeze your eggs, the better the chances that those eggs are in fact going to lead to a live birth. So, to give you an idea, if you're about 30 to 33 years of age, usually we said about 10 eggs for a live birth, but about a 60 to 70% chance of a live birth. But as you get older, that number drops. So, you need to have more eggs frozen when you're older, because each egg has a lower likelihood of leading to a live birth.
Mhm. And now when you counsel people about, say the first choice, she decides is to go forward with egg freezing, what kind of counseling or testing do you offer people?
So when I meet somebody about egg freezing, we do the AMH level, because that is an assessment of how many eggs I can retrieve from a single IVF cycle. We do an ultrasound because we want to make sure that the ovaries are healthy, there's no cysts, endometriomas. I want to look at the access, like how easy it is to be able to retrieve those eggs transvaginally. And we do the infectious disease screen, because as part of the quality control in the lab, we want to make sure for the safety of everybody that somebody that has an infectious disease like hepatitis B or HIV, we have to take special precautions. So that's why we do the infectious disease screen. So those are basically the main tests. And then the counseling would be looking at her age, looking at her goals, looking at what is the timeline that she has for herself. If she tells me I'm not even going to do this until I meet somebody, but versus I'm really worried about the next 2 years. And in the next 2 years, we're already engaged and just going to have a baby in 2 years. So those are the things that I would be counseling about. And then the procedure itself is quite simple. You're taking injections for about 10 days. And the purpose of the injections is to stimulate the ovaries to produce the eggs. The retrieval is done at the clinic, at least at Markham Fertility Center, is done under sedation with an anesthesiologist. Very comfortable for patients when you get anesthesia to provide the sedation for the procedure. So basically 10 days of monitoring, blood work and ultrasound, the procedure. And then after the procedure, like the next day, you can go to work and resume your regular activities.
Oh, that's great. Yeah, it seems it's come a long way since I thought about freezing my eggs.
Oh, yes,
8 years
yes,
ago.
definitely. It has come a long way. Now we use vitrification, which has really changed the game when it comes to egg freezing. Because when we all started, it was this low freezing protocol, which wasn't really great for eggs. But
Mm.
now eggs do really well and survive the thaw really well. So they're basically matching the same pregnancy rates as fresh eggs. Which is really based on age. Age is still the biggest factor. That's one thing we haven't been able to change. But yeah, the field has come a long way.
Well, it's interesting you say that because I think, and you correct me if I'm wrong, but this would have been like 10 years ago when we were talking about it. And it must have been the old technology. And they were saying it almost was better to freeze like a chunk of your ovary or something. Yeah, because the egg freezing and thawing wasn't as reliable, but it sounds like that technology has really improved. And what is the sort of, I know it's probably different from location to location, but the general cost for an egg freezing procedure?
Yeah. So the first thing I would say is that in Ontario, the government would pay for one cycle if it is a medical reason. So, for example, women going through chemotherapy and women that are requiring surgery for endometriosis or because they have an ovarian mass
Mhm.
or something like that, that's an option. And if it is not related to medical reasons, then it's usually about $7,000 to $8,000 to freeze your eggs, and then you have to add the cost of the medications. The gonadotropins are quite expensive. They're about $2,000 to $3,000 for a cycle of gonadotropins for an egg freeze. And then there is a cost of storage every year, and it could vary between $300 and $500 a year, depending on the location in the clinic.
Okay. So we're looking at sort of 10,000-ish.
Yes, if you don't have coverage for fertility medications, it's about that. Yeah, if you have the coverage, then about 7 to 8, and then you have to think about yearly storage.
Yeah. Yeah. And then you would have to think about down the road to use those eggs, you would have to do IVF, correct?
So to use those eggs, you would have to yes. So physically you don't have to go through the injections or everything again because the eggs are already in the lab. So the eggs have to be thawed out.
Yeah.
The partner has to produce sperm, fertilize the sperm, and then the embryos are created. And then you would just do an embryo transfer. So you're doing the IVF up front in a way,
Yeah.
treat the eggs, and then I guess the physical part of the IVF is done up front. The lab part of the IVF is done after.
Yeah. Yeah. That's really interesting. It's so
Mhm.
great because I know it's so hard for young women. And we were talking right before we started recording. It's even harder to meet people. And
Exactly.
it's unfortunate that just biologically our fertility declines more significantly than.
Yeah. And for me, that is the biggest take home message. I think every young woman, even if they feel that they should just be having that conversation with their family doctor or with the fertility specialist, because one of the things that I see a lot in my practice is, gosh, I didn't know. I wish I would have known.
Yeah.
I wish somebody explained this to me. So I always think, I remember going through high school, the message was always like, don't get pregnant.
Yeah.
Oh my God, you're going to get pregnant. And then you get to be in your early 30s and late 30s and you can get pregnant. And then you go to the doctor and you hear all the ways in which getting pregnant is very difficult. So I really feel like sexual education should be about both aspects.
Right.
How to prevent a pregnancy when you don't want it, but also what are the steps that you need to take to preserve your fertility and make sure that you do have the tools that you need to educate yourself and create the family of your dreams. I see so much regret and it breaks my heart that women just didn't know. Nobody told them. The message was always like, don't get pregnant, use condoms.
Yeah.
Right?
Yeah. You're so right. We need to really provide messaging.
On both ends.
And on that side, is there an upper limit, like an age limit where you would recommend not freezing eggs?
That is a great question. And the answer is yes ish.
Yeah. 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 Yeah.
Because and the reason I say that is because it's all about patient choice. So the ideal time to freeze your eggs, I would say, is between sort of age 30 and 34, 29 and 34 in that range. If a woman comes to me at 35 or 36, I say, "Well, yeah, let's do it because that's better than not doing it at all when you're in this situation where you don't have a partner and you're worried about it." So once you get into the 39, 40, then it really becomes a question of, okay, what are we doing? Like, how many eggs are we realistically going to need to give you a reasonable expectation of live birth? What is the timeline? At that point, I might be encouraging them, okay, maybe let's freeze some eggs, but let's freeze some embryos as well. So let's get embryos now with donor sperm.
Yeah.
Just because it just gets so much harder. And I would hate for a 40-year-old woman to freeze her eggs and then come back at 45, at which point her 45-year-old eggs have zero chance. And then you thought out your 40-year-old eggs and those don't work either. And then there is that disappointment. So once you get to be over 37, I think I just have a little bit of a stronger discussion about the options of using donor sperm to freeze embryos and the expectations for egg freezing. But at the end of the day, women have every right to make a choice with their body. And I'm here to educate them and support them. And they get to make those decisions for themselves. But I generally wouldn't recommend it after 38 years of age.
Yeah. Yeah. And it is costly.
Lastly, that's right.
I mean, fortunately, we don't yet have universal coverage for that.
I wish we did.
Yeah.
Yeah.
I know. And then I wondered if you might just briefly touch on IUI for single women and what that might involve.
Yeah. So the first thing is the investigations that we do to make sure you're a good candidate. So that would be the basic things, which is blood work, looking at your AMH level again, your ovarian reserve, obviously a history to make sure you're ovulating, that there is no other medical conditions. We will do a sonohistogram to look at the fallopian tubes to make sure they're open because that's where the egg and the sperm meet. They meet in the fallopian tube. Then, at least at Markham Fertility Center, we had them meet a counselor to go over the donor gamete options from the psychological perspective. And then they also meet with the genetic counselor because when you're picking a donor sperm, you want to make sure that you find a genetic match. And what I mean by that is there are people that carry certain genes that you're just a carrier, so you don't have the disease. And when you meet somebody and fall in love, then you just take what comes because that's just life. But when you are picking donor sperm, then you shouldn't have to just take what comes. You can get a little picky about the genetics. So we have our patients meet with a genetic counselor so that they can be informed about whatever genetic conditions they might carry and what kind of genetic conditions they want to be watching out for in the donor sperm that they're picking. Once the vials of sperm get here to the clinic, then the process is super simple. We use a natural cycle because these are not women that actually have infertility. They just don't have access to sperm. So we monitor their cycle, and once we see that they're ovulating, we take the sperm, the frozen donor sperm, we thaw it out, put it into a syringe, and inject it through the cervix, really close to where the egg should be waiting in the fallopian tubes.
Easy as that.
Easy as that. And the pregnancy rate is the same as it would be if you were having intercourse based on age. So the best pregnancy rate, even in the perfect situation, young, healthy women, is still only about 15 to 20% per cycle. That's just fecundity rate for humans.
Yeah.
So yeah, that's what it is per cycle. So I always tell patients, if it doesn't work, doesn't mean anything is wrong. It is humans are not that great at reproduction, and we have to try it a few more times, usually about 3 to 5 times before we say that it's really not working and we need to look at different options.
Yeah, that's great. And it's nice to have a spectrum of options available for people who don't necessarily have to go straight to the more invasive procedures, especially if you're trying to explore this at a younger age.
Absolutely. Yeah.
Um, and I think it's really exciting. And I don't think we talk about it enough, like you said.
No, I actually wrote a blog about it. It's on my website, www.drmeivysgarcia.com.
Okay.
And the blog is exactly called that, Options for Single Women Looking for Fertility Preservation. So I go through all of that. And I wrote because I was being asked about it a lot. So I figured I would put it out there for anybody who has questions about that.
Yeah, well, that's great. And if we'll link that in the show notes. And I think it's really good, especially as family physicians and primary care providers, to consider this when we're seeing our young patients for their pap tests.
That's great.
Right? Just to mention it so that they know it's an option. Because I have a ton of single young women that do want to get pregnant, but just haven't met the right person yet. So for them to not start thinking about this till they're later in their 30s when they start to worry about their fertility, you're almost you are at a disadvantage biologically.
Yeah. Big time. Yes, unfortunately, yes.
Awesome. Thank you so much for this conversation today. And now we met through Instagram. And so I thought you'd share, because you share some great content on there, share your Instagram handle so our listeners can find and follow you as well.
Yes, it's at doctor, so Dr.
Yeah.
Meivys Garcia, Meivys, Garcia, Garcia on Instagram. And yeah, so that's my Instagram account. And now I'm taking over the Instagram account for Markham Fertility Center, to Markham Fertility Center as well. So there'll be some great content coming there as well.
Awesome. And that is in Toronto, Canada, correct?
Toronto, Canada. Yes, Toronto, Canada.
Toronto a handful of times, which is like shameful for a Canadian.
Well, you need to come back and I'm going to take you out. Yeah, we'll talk about all of the things.
I would love that when we can travel freely again someday.
That's right. That's right.
Yeah.
Yeah.
Awesome. Thank you so much for taking the time to chat with me today. It was an absolute pleasure.
The pleasure was all mine. Thank you very much for all the great work that you're doing, educating women in all things related to motherhood, postpartum, fertility. It's amazing. And it's such a high need for that. So thank you.
Thank you. Take good care.
All right. Take care. Bye.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.